patient's chart, assess the need for the procedure. I see that it's been 7 days since my dressing change, so we're gonna go ahead and perform the dressing change at this point. All right, so good morning, coming in, close the door. Good morning, my name is Christine. I'm going to be your student nurse for the day. Can I please have your name and date of birth? Okay, Mr. Smith, do you have any allergies? All right, Mr. Smith, so the reason that I'm here today is because it's been 7 days since we've done your dressing change on your central line. So we're gonna go ahead and do that now if that's okay with you. Do you have any pain at the moment? No, you do not have any pain? Okay, great. If at any point during the procedure you do experience pain, please let me know so we can stop and medicate you. All right, Mr. Smith, so I am gonna elevate your bed. Okay, I'm gonna bring it up to my waist level, and for this procedure, I do need you to be laying flat, all right? So I'm gonna go ahead at this time and lay you flat. Bring down this rail. And Mr. Smith, I am going to ask you to please turn your head away from the insertion site to prevent any infection. And if you can tolerate it, I'm gonna put a mask on you, okay, as well as a mask on myself. So, I'm gonna open my kit. And my kit already brings a mask. Some of them bring two, one for the patient, one for you. You can always bring it from the outside. All right, Mr. Smith, go. Okay. I will now put on a pair of clean gloves. Okay. All right, I'm gonna expose you. And I am going to inspect my site, make sure there's no redness, swelling. I'm gonna touch, make sure there's no tenderness, any pain when I'm touching, no, okay. So with one hand, I'm gonna stabilize, and with the other, I'm gonna go ahead and slowly start to remove that dressing. All right. And once I have completely removed it, I am going to assess for coca, color, odor, consistency, and amount. All right, and dispose of it in the appropriate receptacle. If there's any blood or anything, that I will put it away in a biohazard bag. Otherwise, regular trash is fine. I will again take a closer look at my site, make sure there's no discharge, swelling, foul odor, etc. And at this point, I'm going to check for migration. All right, so either, and I'm gonna compare it to what was on the board. So either I'm gonna look at the number of the line, all right? Sometimes you'll be able to see the number at the insertion site, or I will at this point grab a piece of tape, and I can do this. So this kit brings it inside. You can just have a piece of tape because you are dirty at this point, and just measure, okay, and compare that to what was on the chart. So I'm assessing for migration. That's all you have to tell me, assessing for migration. All right, okay, Mr. Smith, I'm gonna set up my sterile field. If you can please stay very still. I'm gonna dispose of that. Hand hygiene. And now I will set up my field. All right. I can pull out my gloves and utilize that if I like, okay. And there are a couple ways to do this. The way that I like to do it is I'm gonna grab my drape,
1 inch borders.
1 inch borders. Make sure you do it high so nothing touches, okay. Shiny side down. And now I can grab my contents and throw it into my field. 6 inches above, okay? Remember I said your bio patch does not come in any of these kits, so you're always gonna throw it in there as well, okay? Now guys, maximize use of your table, so I like to move my field closest to the edge as possible. So now I have all this space to work with, okay? Remember, you cannot, this finger cannot touch the outer cuff. It's sterile to sterile, which can be very difficult because you can see that this is kind of stuck, right? And it's not lifting very well. So, because this hand is gonna go inside, I could use it to help me get in. And this happens to all of us. Fix it now that you're sterile, okay? Alright, so now that I'm sterile, I'm gonna set up my supplies. Alright, take this time to really set up your supplies. Alright, so this one does not bring a chlorhexidine swab, but it brings the ChloraPrep triple swab stick. That's fine, I work with what we have. Alright, so we can use this. I'm gonna open it. But for this purposes of this validation, we're gonna pretend that this is alcohol, all right? And then pause. This is not part. Okay, so we'll pretend that there's a stick. All right, so you need your cleaning agent, your antimicrobial patch, okay, and your clear dressing. All right, the rest you may not need, so just set it aside. With the clear dressing, because I'm only gonna have one hand to pick it up and put it on, what I like to do is create a little slit, okay? So that way it makes it easier for me to pick up once I'm ready. Okay, so now that I have my supply set up, I'm gonna lose sterility of my non-dominant hand to stabilize my line. And again, pretending this is alcohol. All right, I'm gonna clean at the top in a semicircular motion. Dispose. Lift up. Bottom. Dispose. Again, this is alcohol if your patient is allergic to chlorhexidine. And then I'm going to clean my line. Dispose. Now, because this is chlorhexidine, how you would clean with this, if this is what you had, all right, and it brings 3, which is a lot, but then you would do the other one at the bottom, and then you would scrub like that, okay? Your kits may not bring that. Most kits only bring 1 chlorhexidine swab, the bigger one, but it looks like this. So what you would do in that case is snap, shake, and scrub the top, scrub the bottom, and obviously around it.
With the same swab, right?
Yeah. And then scrub the line. Let it air dry for 30 seconds. You'll notice your kit brings alcohol prep pads. In case the line is soiled or has blood or something, then you would use this to wipe it down before and then use your 1 ChloraPrep to clean.
How would you open that with one hand?
No, you wouldn't, but you would see if your line is soiled beforehand.
Okay.
And you would open it up beforehand. I mean, if you have to, you'll figure it out, but it's very hard. So that's why I say you have to beforehand. You know if your line is soiled, then you would need to use it, then you would open it up. All right, so now it's air dry for 30 seconds. I'm gonna get my antimicrobial patch. All right, and blue goes up to the sky. So I'm gonna apply that over my opening. And then I will grab my clear dressing. Now this is still sterile procedure, all right? But I obviously need 2 hands to place this down. So the only part that I can touch with my dirty hand is the back part that's gonna go to the trash anyway. That's it. And utilize that to help you stabilize and cover the site, okay? Now that it's covered, I can use both of my hands because sterility is no longer important. All right, this came off already, but if my hands were not soiled, or I would take it off, I would put my initials, date and time, okay? And then the final thing is whenever you do a dressing change, you need to check the patency of each of your lumens. All right, so I would grab my lumen, make sure it's clamped. All right, remove this alcohol prep pad or clean it if it doesn't have the antimicrobial cap. Connect your 10 ml syringe and then unclamp. All right. Now I'm going to flush using the pulsating method or push stop. All right, so 10 ml of normal saline. My line is flushing fine. And once I'm done, very important to clamp and then remove. This is very important, guys, because otherwise you create a positive pressure issue and you can burst your line. So make sure that when it's clamped, then you connect, okay? And then make sure it's clamped before you disconnect.
And it doesn't matter which one you flush with.
It doesn't matter which one you do first. You're gonna check all 3 though, okay?
With the 10 ml syringe, each of them.
Yeah, do that one, grab the other one, and do the same process. All right, and that's it.